Hello, I'm Daniel Clark. In this context, am from Berkshire Healthcare, and I'm a project manager for our digital marketplace solutions. Specifically, what we've come to talk to you today is around how we've introduced Elemental and used that tool to streamline our social prescribing solutions.
Hi, good afternoon. My name is Sophie Trezise. I'm the Digital Transformation Manager for Berkshire Healthcare NHS Foundation Trust. Clinician by background, mental health and learning disabilities, and then joined the digital side about 7 years ago and haven't looked back since.
Just to get into a little bit of framing who we are and where we come from. Berkshire Healthcare is basically is community and mental health trust, and we are also deal with children's services as well. Yeah. So we're kind of fingers in all the pies, essentially. But in the context of mental health, we have done a large piece of work. Actually, you probably should let you lead this. Large piece of work over the past year to unify our ways of working.
Absolutely. So yeah, as you said, thank you, Daniel. We're a community and mental health trust. We have over 5,000 members of staff across 6 localities and 2 ICBs. And back in 2024, we spent a lot of time looking at our adult mental health services, looking at from that referral to discharge and beyond, and wanting to streamline those processes, that kind of no wrong door approach, telling your story once, seeing that right professional, the right care at the right time. And what was really exciting from that is once we reviewed all those processes and streamlined them, then the digital side came in, that kind of digital wrapper around that care that really enhanced then that process. And one of those digital offerings was Elemental, the social prescribing solution, which I know Daniel's going to go into a bit more detail now about the team we predominantly use that with.
Yeah, so all of the staff, all of the patients, that come in through Berkshire Healthcare, coming through our common point of entry team. And so they do the initial triage of all patients, then forward on. Everyone's probably got something similar. And what we found is that they already had in place a social prescribing team, their community navigators. And this team were doing everything on spreadsheets, as you did. They've had Word documents of their lists of the various VCSE partners that they need to refer to, everything from a Word document based for their drug and alcohol clinics, or a spreadsheet based on here's the things in this particular locality and here's the ones in this particular locality. So even though you had one team that is there sort of as your point of triage to kind of offset the people that do not need to have the clinical care, their work was quite laboured, essentially, because your clinician would refer through, give them a call, say, look, you don't have clinical needs at this point. We think your needs are broader than that. The biggest hitters are homelessness, food banks, and that side of things. And so we knew a quick win, essentially, was Elemental could sit with our CPE team to make their lives a lot easier. We also had another team in the trust, which is our Let's Connect Wellbeing Network. And this group is a small group, completely non-clinical, who would go out and have coffee mornings, essentially. That basically, and then they'd social prescribe from there. So they'd be set up in a church in one town, or basically just visit a coffee shop in another, hold meetings. People would be openly to come along to their meetings, and then they'd recommend solutions there. But again, spreadsheets. Sometimes they didn't even have the person's name, and that moving forward. So we knew that by getting Elemental in, we'd be very quickly and easily able to help these services. But the big win would be across the mental health teams as a whole. But when we first started working on the project in 2024, we came across a number of problems, largely in the ways that people were thinking. So the thought is we tell everyone, hey, we're going to give you Elemental as a tool. And they turn around and go, that's brilliant, that's amazing, that's going to just offset all of the needs of our staff. We can just quickly refer to Elemental from Rio, and then that patient is just going to be completely picked up by the system, and that system will tell them the ideal VCSE that they need to go to. Obviously not the case. We then needed to go, no, there actually needs to be people involved, which means we've had to work really closely with our mental health leadership to kind of go, okay, where are these people going to come from? And the first port of call that they turned around and said, well, we've got community connectors out there. Why don't we use the community connectors to be these link workers or navigators and all the different terminologies where you sit, and you kind of But those community connectors are people that go out, help someone with their shopping for half an hour a day, or go and take them for a game of squash and things like that. They are directly engaged with the patient. They have no way of picking up this workload. And this is a lessons learned for anyone that is looking into Elemental, that you need to have that dedicated hub of navigators that will be able to focus. And it is a very fine skill set, because the Elemental tool is brilliant. It is that depository of information that you need, and it is a great way of storing all the VCSE and be able to connect them quickly. But you need someone with the skill set to take that tool and maximize it and make the most of it. We also then introduced a web version, and our directory is available with the digital marketplace, as it's called. But you run into them problems with that, because as we've talked a little bit about with the neighborhood stuff on our table earlier on, the challenge you have is not all VCSEs want to. So you're going to go, it's brilliant if we onboard have this tool that can really utilize all of the VCSE information. If they don't want to provide you information, and you go out there and their basically response is, what's in it for me? And you're trying to convince someone, okay, your drug and alcohol clinics, they're happy to sign up and provide the information back, because there's that two-way of care. But your average art class or someone that is providing a support network doesn't do so. So we also faced internal challenges around the website as well, about does it fit the tone of voice of our other systems, and how does it look in relation to our other offerings and other means of self-referral. So what we're kind of saying is that Elemental is a great tool, but unless you've got the right people and the buy-in around it, and the amount of different opinions we've had with VCSEs over this time, it can be a bit of a slog, I guess, is the best way of saying it.
Right.
You end up having to, everyone's got a different opinion on how we should work with VCSEs. That being said, we did move forward with the team that we knew that it would work with, CPE, and we went straight away with putting the system in, and with about 6 weeks, we said, let's go live, let's build it up as we go. But that was counterintuitive, because whilst it was really quick and easy, great project engagement from Access Group side, what we came across was that if you have multiple different lists all over in different locations and different teams, your CMHT team has one list, your CPE team has another list, and you had lists upon lists, it was actually, you find people trying to do referrals, but not having all that information at their fingertips. So within about 3 weeks, we said, stop, we can't do this. We're going to have to roll it back, take it out, stick with your spreadsheets until we've got that tipping point with about 500 different VCSEs across the trust, that we could then be able to go, okay, we'll relaunch it, move forward. It is the sole depository of information for VCSEs, mental health. And that led us onto the ability to realize some of our benefits.
Yeah, thank you, Daniel. So I know a really common theme this morning in particular is around that kind of benefits realization. And I'm a true champion and believer that before we do anything, we should always look at the high level benefits of something we're trying to achieve. Are we going to see those successes in order for us to actually drive what we want to do? So it was lovely from the outset that we had quite a clear vision on what we wanted our social prescribing tool to do and what kind of high level benefits we were expecting to see. You'll be pleased to know I won't read all of these out to you. I know your time is precious. But there were some key things around client benefits in particular. We really wanted Elemental to support with that kind of easier access to our community services, and also to those patients feel they were actually get their help faster for their social care needs as well as their clinical. For our staff, probably one of the main benefits was that clinical efficiency, saving time. We'll go into a little bit of detail shortly, but saving hours of clinical time so they can actually focus on the pertinent clinical work we were here to do in the first place. And also streamline our referral process and just focus on those clinical priorities. What was really lovely is, as Daniel was alluding to, we had all these different spreadsheets. So we actually had no real mechanism of reporting any of the great work that we were doing around engaging with VCSEs, those VCSEs engaging with us. So now we had one central place to record all of that great data and to share that with others as well. And there's some more long-term benefits around reducing that clinical demand for social cases over time, that prevention escalation through early support. And what I was really keen to see as well was that kind of real true co-production, not just with our clinicians and with our services, but with our health and social care partners, with our VCSE partners, to help drive that cultural change and that true neighbourhood working as well, we're really seeing materialise. Lastly, as well, kind of around that client self-management as well, that kind of self-advocacy and giving those tools to people so that they can utilise them if they wish to as well, and not solely reliant on us in order to receive that information. So that's what we were aiming to achieve. Big, ambitious list, I appreciate. But it's good to have goals and to strive to great targets, and that's what we set out to do. So what was the analysis? What were the trends? What did we see? As Mark alluded to earlier, we use population health data a lot in our trust to help inform decision-making and next steps. So some of the trends we were seeing from using this is over a sort of 11-month time span. On average, we were seeing 120 referrals per month from this one team, which was really fantastic and obviously really rapidly grew from December when we relaunched, then stabilized about April and May. And we've seen that consistently now happening since then, which is really, really pleasing to see. As you would expect, we heard from staff, both from the VCSE side and from our side, so for the navigators and from our clinicians. They're using it daily or several times a week. So that's really, really pleasing to see. And then when we delved into the sort of age demographics, we were seeing actually some really good trends around the age brackets of 25 to 34, 35 to 44. Consistently, they were our highest number of referrals. And then we also, from December to April, saw a really significant increase in engagement from our 19 to 24 age demographic, which was interesting to see. And so we were looking at what other further opportunities we could do for our targeted outreach in that area as well. What wasn't really surprising to see and what we really want to tailor our communication with further now is our older population. It would definitely be unrepresented there, and that's where we want to target our efforts next. And our kind of top reasons for referral for social prescribing over the last 11 months have been no real surprise around mental health and well-being, housing essential needs, and also our addiction support services too. So that's what we were kind of seeing over our 11-month span. And what have we realised so far? So for just one of our teams, what is really lovely to see is actually we have reduced the average time that our patients remain on caseloads by 71%. Which is amazing for us. And I think that's predominantly because we're being able to channel our clinical efforts where we need it most. So on average, teams were telling us about 30 to 40%, depending on our locality. Those cases didn't require any clinical intervention whatsoever, but really did need that social support and engagement. So we didn't need to do those assessments with those people. We didn't need to worry about those national data sets and all that sort of mandation we needed to do there. We could discharge our referrals from Rio and use the Elemental system to still support that person. We're still receiving that great care, but we're just using it through the Elemental system instead. So I think that's predominantly a lot of the big reasons why we've seen such a great reduction there. And then I truly believe we have to, the voices of our staff and our patients give us the best insights. So we asked them directly how they found using Elemental. And 86% of those felt that actually using Elemental compared to their previous process, it was much better. And we expect that trend to get higher as we roll out on our adult mental health services who don't have the kind of mechanisms that CP have done around engaging with VCSE support. 100% agree that Elemental improved overall patient care and experience, probably the most important one to us in the trust, and really pleasing to see. And then also 84% of staff felt that actually Elemental reduced patient waiting times for those with a primary need for VCSE support. So it's really amazing. We obviously won't stand on our laurels. We want to ensure that's still consistent, and we go back into our teams, ensure those changes are still embedded. But it's really lovely to see that trend thus far. And as of anything with benefits, we always want a forecast. What are we striving towards? What sort of targets are we expecting to see, particularly as we roll out in the new year across our 6 localities? So what was really disheartening to hear, and I remember this as a clinician, staff would tell us that they would spend on average about 4 hours per patient trying to find the right VCSE support for that person, checking is that information still correct, does that VCSE still exist, is that email the one I should be sending it to? So actually that's going to be released now from our clinicians, and they can focus on the great work that they do. And looking at the amount of referrals we receive and the kind of trends we're expecting, we could save just over 36,000 clinical hours per annum, which is amazing. What we'd also like to do, we want to be modest and careful and look about reducing our average caseload within that sector as well, and looking at about 7 days per patient, sort of 41% improvement, and hoping as trends go on and ensuring we've embedded that change, we'll see that grow and grow as time goes on. And then, of course, we've got a really good staff satisfaction rate already, but we'd like to improve that. So looking at 95% as we roll out across our adult mental health services as well is our next journey forward. I won't read all of these out, you'll be pleased to know, but I think sometimes hearing from our staff and our patients is just as powerful, if not more powerful, than data itself. So it's been really nice to hear from our CP navigators who use the Elemental system. They've said it's been really helpful to signposting, easy to keep track of referrals, better awareness of services in and around our county than before. So it's been really lovely to hear how that's benefited their working lives. And then for our clinicians as well, either it's been clinicians using the system or about to use the system and have trialed it. I find IT hard and it looks so easy to use. I love it. It's going to save us hours of work. This is a blessing. Will really help with those GP reviews, seeing Elemental and sense checking what's happened with my cases and what they've accessed. And then also things about our waiting time. Sometimes some of our clinicians have shared that out in the community there have been 2-month waiting lists for some of their patients and still waiting. And they really feel something like this will help dramatically improve that. And I now will hand over to Daniel.
Yeah, so as Sophie alluded to there, we've spent this last year getting the team in place, and we have to look at our wider team. So we've got 140 teams on Rio across the mental health services, and each of those are going to be turned on in January, which is when we hopefully get to see those real big benefits for our trust-wide rollout. And then we will be moving into expanding our directory of services. So as I mentioned, we've got about 500. It's nearly up to 600. So it's 500 when we launched last December. It's now around 600. But we are making that available beyond the mental health teams now. And we've got various tools and techniques to then get the lists to expand to children's services in particular, to be able to find those organisations and VCSEs that can help the under 18s as well, because that's the area of the mental health sphere we haven't touched on yet. And then we will be looking at either going with children's services or into our physical health world as well. But again, lessons learned from our first one, we need to make sure the hubs and everything is in place before we're able to do that to move forward. That being said, we are also looking at what offerings that we've got there. So now that we've got this new team in place, we're going to go, what can they do that's beyond just the Elemental tool itself? So they will take the calls in from all of our wider clinicians, but actually is there anything else that they can do? And we're going to get them set up in various locations to 1 day a week, essentially, to go out and do that outreach for the people that won't be coming through our normal CPE channels or will not look to engage in VCSEs. We're going to proactively go out there and set up the opportunity to sort of give them an avenue to do so. And if you want to, we also would like to continue working with Helen and the team to improve the product itself and to give the various bits of feedback, because one thing we have gathered over this past year is what bits work well, which bits don't, or can be improved. And what we would love to see at the moment, you can view the records within Rio. What we've been told is in terms of all that process that people do, they still go in and have to fill a note in Rio to say that they've done Elemental in the progress notes. Whereas actually, if we could get that data that comes back to see who they've been feeding directly into the system, that's the one we've been asking for at the beginning. Please help us out with that, because that will save processes across the board. We're also looking with the marketplace where on the web, it's basically, there's a few things it doesn't do. You can't use a screen reader, for instance. So it does limit who it can be used by. And we want to go public with it next year and actually sort of really promote it on social media. So in order to do that, we want to make sure it's accessible to absolutely everyone. And these are no surprises, by the way. I'm not just popped a slide in and not told them about it. We are working on these. And as I mentioned at the beginning, our expectations when we first rolled it out from an operational perspective is that, the system can just do it itself. It can go from, they put the RIA referral in and then it will find the right VCSE. And I know that there's work already being done on this in terms of using AI to help speed up that process, the number of people that can be seen, and then the size of team that you need can be reduced, which is what we're hoping to do in advance of the additional hubs. And yes, then looking at ways of integrating our marketplace with other platforms. So, for instance, with our patient portal and things like that. So they don't have to go to multiple different things to find it. There's going to be one central integration spot.
Yeah.
Yeah.
That's it from us. Thank you ever so much for listening. Really appreciate it.